Hello, my name is David Anderson. This presentation will discuss cervical disc replacement as an alternative to a spinal fusion, and it'll be presented in a way that is meant for a general audience, not necessarily academia or the medical field. So in case you've forgotten, the cervical area of the spine is the neck, and there are 7 total vertebrae within the neck, and 7 is the one at the very bottom. Now, why is this information of any value to you? Well, I'm going to share from my personal experience. I was active most of my life. I was a tradesman, studied and taught martial arts as an adult and as a child. In my youth, I played soccer at an international level. As time passed, that changed, which resulted in my familiarity with this topic. What leads to having to consider the option of a fusion or a disc replacement is degenerative disc disease, and it's caused by a variety of different things. That it's pretty common. There are more than 3 million US cases per year. Typically what the case is, the discs dry out over time just from aging. Also daily activity, just general wear and tear, wears on the area between the vertebrae, causing some damage and degeneration. Same with sports, heavy demand, and injury. Degenerative disc has 2 main causes for the pain flare-ups. The discs leak out a protein, which causes inflammation. Inflammation is just a swelling. Well, that swelling, inflammation, then creates some nerve impingement, which then causes tenderness and muscle spasms. The current slide illustrates how the degenerative disc has collapsed and created the impingement of the nerve. And you can see here that the bone spurs, that's from the rubbing of the bones next to each other, creating calluses. So when you end up with the degeneration, the most common approach was an anterior cervical discectomy and a fusion, which meant they took the disc out and then fused your vertebrae together. Excuse me. What that involves is an incision in the front of the neck, typically, and they got to move everything aside just to get to the vertebrae in the back. Then they go in and they actually remove the discs and then grind down any of the bone spurs that had developed from the friction, prepare a bone graft. In my case, it came from my sternum, but they can come from a bone bank or even a synthetic grafting material. And then the fusion is created by putting the grafted bone in between the vertebrae with an additional metal plate, and then screws going through the plate into the vertebrae. And occasionally they'll use a thing called a cage to surround the bone graft, and that's just to help the graft develop as it's healing. Cameo for you. This is actual x-ray of my resulting fusion. And you can see there by the arrows kind of highlighting the specific areas on the elements. To me, the amazing part was the metal plate, let alone the bone that went in there, but the metal plate that locks everything completely in place and the length of those screws. And so from that kind of procedure, you have some recovery time. For me, I was in the hospital for 3 days. It'll vary 2 to 4. Following the surgery, you are put in a Aspen collar, and it's a cervical collar that locks you in completely. You're in that thing 24/7 for 3 months. I was actually issued 2. I had one that I showered in and one that I wore every other time of the day. Following the collar getting removed, then I went through 3 months of intensive physical therapy, which included a variety of stuff from mobility to procedures like dry needling, which is kind of a combination of TENS, which sends a current through you, and acupuncture. So I actually put needles into your body, send current through you, trying to help the muscles recover from the trauma that has occurred from the surgery. And unfortunately, like most procedures, there's some common risks and complications. Most notably, additional stress on the adjacent vertebrae because nothing is moving anymore. You get a potential of an infection at the wound area, some nerve damage, extra pain and weakness. There can be respiratory challenges. I didn't experience that, luckily. Blood clotting, because they did intrude on the body, slowed things down. You could have a heart attack or a stroke during the operation. You can have a residual pain after the graft. And sometimes you can have aesthetic or medical complications. So you could have an issue while you're in surgery. And the list continues, unfortunately. Sometimes the fusion doesn't really take. The bone just doesn't heal right, and so it requires an additional surgery. Hardware can cause a residual weakness and pain, inflammation, because your body was traumatized. Another expansion on the fusion, because the vertebrae no longer function from the immobilization, it puts the adjacent regions at greater risk of wear and tear because there's nothing giving the same way it used to. And if there's poor health issues or inactivity, that'll exacerbate the problem and you won't heal right, or it'll lead to greater complications, even requiring more extensive surgery. But luckily there's an alternative, cervical disc replacement. It's got a few different names, and it's a great alternative because it doesn't have the same immobilization within the vertebrae compared to a fusion, because again, it doesn't lock. There's a couple of brief qualifications. A person has to be done growing. And that's typically for females around age 18, for males around age 21. And especially if the symptoms have not been relieved by other procedures prior to considering a surgery, and there has to be at least damage to one of the discs, which is pretty common. In my case, it was two. Disc replacement procedure is somewhat similar to a fusion, excuse me, in that the preparation is similar. They get you on the table, clean you up, make an incision at the front, remove the trachea and esophagus over the side. Same with everything else that's in the way, so they can get to the vertebrae in the back. They will deburr you, basically get rid of the bone spurs that might be there, and then put the replacement discs in before closing you up. Here you can see in this illustration the makeup of a disc replacement. And the little diagram on the upper right corner clearly illustrates what that means in respect to mobility compared to a fusion, because as we compare to the previous slide, you can see here that the fusion, the graft, has created a lock to where there's no mobility. The spine can no longer flex, which then leads to those other issues, whether it's mobility or residual effect of the adjacent vertebrae. Replacement versus fusion. The main difference is, and there's a few statistics that are thrown up here for you, but the big difference between the two is the fact that the replacement no longer limits the mobility issues that are common among fusion patients. And so I hope that this information is useful for you, so that in the future, likely you'll face this because we all age and degenerate, that you will have information that I was naive to when I had to undergo this procedure myself. Thank you for listening. I hope you enjoyed the presentation.